Strike and the Employment and Labour Relations Court yesterday evening stopped the planned industrial action by members of the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU. In a ruling Wednesday, Principal Judge Byram Ongaya said the decision to suspend the strike allows for a resolution to the impasse. The judges issued the orders requiring the Ministry of Labour and Social Services to convene a meeting between the Cabinet Secretary for Health, Susan Nahumicha, and the doctors, hoping to find a solution to the issues raised by KMPDU. The Kenyatta National Hospital had moved to court seeking to bar doctors working at the hospital from going on strike after the lapse of the 7-day strike notice. Following that directive by the Labour Court, we want to get the views of the doctors' unions. Now, I'm joined by Dr. Dennis Miskala, the Deputy Secretary General at the Kenya Medical Practitioners, Pharmacists and Dentists Union. Good morning to you, Daktari, and that decision by the court that the strike gets suspended. What is the view on that, and will the union respect that court order?
Thank you very much for having me, Jesse. We have not been served the said order, so for now we are still waiting for its service to us. But we also want to say that government or any employer cannot go to seek equity or justice with the dirty hands. The government has 3 contempt charges on them, and they must purge those contempts before they go to seek justice or equity from anyone. The first contempt of court that the government has done is a contempt against the 2017 CBA. These are collective bargaining agreements that the government itself and its lawyers took to court and deposited as a court order. And it is this court order called the CBA 2017 that they're supposed to be doing. Yet they have done everything against it. The delay in paying reporting the interns against the CBA of 30 days. The delay in implementing the basic salary against the CBA court order 2017. And we went to court again in October 2021 to complain and report them that they have not implemented the CBA. And the judge, Justice Monica Baru, gave another order for them to implement the CBA and report in 60 days. They again did not implement that court order. We went again to court the other day about the housing levy that was declared as constitutional. We then again told them that is a court order, stop the deductions. They have continued deducting the housing levy. So the government has 3 court orders they have ignored. So they must purge those contempts before they go to seek justice anywhere. You cannot go to the table of equity and justice with the dirty hands. That's the first thing that we have to say. Number 2 is that there is a court order that told the employer and the unions 2 years ago that any time doctors go on strike, there should be a minimum service agreement that the patient must not suffer, patients must not die because of a strike. So they were told that the union and the employer should agree on the minimum services they can offer. Maybe in the emergency areas in the ICU, that patients don't have to die because patients are innocent in all this. As a union, we are out to the government to tell them to comply. We sit down and agree on a minimum service agreement. They refused. The current CBA we have with Kenyatta, which they have refused to sign, has a component on the minimum service agreement. They have refused to sign that CBA. So we are happy that finally today we have been called for a meeting to have a discussion on the minimum service agreement. But even before we have that discussion, we already told our members that there should be some minimum services occurring in the critical areas like ICU and in the casualties. So that's the position of the union.
Daktari, as we speak to you, are you confirming to us that indeed the doctors are not offering services in hospital? And with that now, I'm being informed that there is a meeting that has been slated by the Ministry of Health and going to Treasury to try and avert this stalemate. Is there room that the government have approached you to try and sort this problem as we speak right now?
Yes, Jesse. As a union, we are open to dialogue. We have been open to dialogue for the last 7 years when we first had our CBA. Even in December 2023, when we gave our 2022, when we gave our first strike notice, we were called for dialogue, and we sat in dialogue for 1 whole year without any outcome. We gave a 7-day notice to make them have dialogue with us. What did they do instead? The PS would call us for meetings, and the CS calls for parallel meetings to undermine the PS's meeting. We'd go for meetings with the PS, and you'll find the CS addressing media without even attending the meeting. It is the government who has been on strike for the last 7 years. The union simply joined it. But if finally they have woken up from their slumber and are now ready to sit on the table, we are more than willing to attend any meeting anywhere to avert any suffering or unnecessary deaths of any Kenyans. We are ready, we have been ready, and a strike is not a sign of a broken down negotiation. A strike is the power with which workers use to compel stubborn employers to come to the table to negotiate. And once they negotiate, they sign the collective labor agreement, and they have to implement it. They have to implement it. A CBA is part of an employee's contract. So when you go paying, when Kenya go paying doctors half salaries as their colleagues in the PNP, and then they employ 80 of them on contracts, paying them half salaries against a court order, then it is the government in contempt of the court. It's the government on strike. And the Minister of Health and the counties will squarely have to carry the blame of any suffering that Kenyans will suffer in during this strike, which is a vocation by their own belligerence and senseless stubbornness that needs to stop.
Daktari, a court order has been given by the courts stopping the strike today with the room for further negotiation. In show of goodwill and in support of fellow Kenyans who need your services, is there room that you might consider that court order and go to a negotiating table to at least come to an understanding and alleviate any pain and suffering from Kenyans, Daktari?
Sure, Jesse. Once we get the court order and it is served to us, we will then convene our National Advisory Council that then is mandated to call off the strike. So once we have agreed and our lawyer tells us the authenticity and interprets for us, because we are also not legal experts, interprets for us what those orders, because there are various orders that have been given by the strike. In fact, the judge has gone ahead and said that in that order, from what I've seen somewhere in the media, is that he wants the patients also suffer, but he also wants the strike to be effective. So as a union, we're more than willing to obey the law. Unlike government, we are a law-abiding union because we know that justice is always going to be our shield and defender, that we have to be people who abide by the law, both government and both unions. So unlike government, we are more than willing to comply with the court order once it is up to us.
Daktari, we look forward to that engagement between you and the government, the ministry. Today, we hope that Kenyans will not suffer and that you'll be able to restore services in hospital, Daktari. That is the